Welcome back. We continue our focus here on the media view on day one of the rollout of vaccines, COVID-19 vaccines to the teaching community, the education sector. We've seen what's happening in the Western Cape and parts of Gauteng just a short while ago. Now we're going to be going to KwaZulu-Natal and the Northwest Province. Their departments, of course, talking officially of the start of this vaccine rollout. In KZN, infections continue to surge, even though they are not yet experiencing a third wave, and in the Northwest, 720 new infections were recorded over the past 24 hours. Let's go now live to our reporters, Dasen Thathiah in Durban and Lindokuhle Xulu in the Northwest. Let me start with you, Lindo, where you are in the Northwest at some center there. How is the vaccine rollout happening there for the education sector?
Well, everything going smoothly, Braden, and I can tell you that on this day of the launch of the 10-day program, the provincial government here in Northwest has assured the province that they will, in fact, finish on time. They are not foreseeing any problems. In fact, what they told us is that 28 sites have been set aside for educators to actually get vaccinated, among others that are 40 plus that are vaccinating in other phases. But we just want to speak to the MEC of Health in the province just to get a sense really of how things have been going. You are at one of the centers, MEC. Just give us a sense of how today has gone. It's the first day, but we have seen many teachers getting vaccinated at this particular site.
Yes, of course, you have seen many teachers, but we must also confirm, myself and you, to the studio, that as we speak now, 450 has already been done, which therefore means that the program remains a success as launched, but it is across the province. This site was only identified for formal launch, but all other sites are operational. We will deliver the vaccination for education sector in time and as expected, but always when we deliver vaccination also to create an impression to the public that vaccination does work and that vaccination has to be taken by all those who are in the line of registering and getting vaccine.
Let me see, there is also the issue of the numbers, 720 in the last 24 hours. That is the latest number. You said yourself that it's quite high for such a province of such proportions, but just give us a sense then of what you believe the response should be, particularly as a neighboring to Gauteng, which is also a growing concern.
Yes, I said that 720 for Northwest on a day. It's even more than what we're seeing in Gauteng because of our size in terms of the population. But that 720 per day should be a number that first on response to stop the increase of numbers, communities, and everybody must play their role. But secondly, when you have now people who have been confirmed positive, isolation tighter and management, and ensuring that then the response to health facilities are ready, because you don't know in the 9,900 active cases today how many would require hospitalization tomorrow. That's why immediately when your number increases, both sides on response and the second side on the response of health facilities, you need that process jacked up. For now, we still have a challenge, very serious, on availability of isolation sites and availability of quarantine sites, especially in districts like Dr. Rutsi Khumutsi Mumpati, which previously in the two waves, it was not affected as it is affected currently.
And just as the last one, there is consideration that a province such as Gauteng, which is your neighboring province, might be put on stricter lockdown regulations. You said that you don't believe in that and that you actually believe in a more comprehensive response in terms of the capacity and all those things. But give us a sense of how Northwest as a neighboring province would then be affected by Gauteng being put on a harder lockdown and instead of the entire country.
The harder lockdown for Gauteng, that must be discussed with the Gauteng Provincial Command Council, but the impact of locking Gauteng, it's going to affect provinces like Northwest, because where we are in Bujanala, 50% of healthcare workers who work for the Department of Health in Northwest reside in Gauteng. If you increase Any movement in Gauteng, it therefore means they are going to be affected. But what we think that is better, we can have adjusted response principles, focusing on what is a challenge at a time, so that the country then can be coordinated jointly on a lockdown, but with emphasis there and there, depending on the necessary needs of a province.
All right, MEC, let's leave it there for now in the interest of time. Thank you so much,
Thank you very
MEC
much.
of Health here in Northwest, just giving us a sense of saying that today was a success. They already gave us those numbers, saying about 400 in this site alone, but there are 28 or so sites in other places where teachers are getting vaccinated. But more so touching on the issue of whether Gauteng will be put on a harder lockdown or not, the MEC believes that a response should be created in terms of what is needed to deal with the numbers, instead of actually trying to lock down Gauteng, which will see other people moving to other provinces and causing problems there.
Thank you very much, Lindokuhle Xulu in Northwest. Let's go to Durban now. Dasen Thathiah, your side of the country, how is the rollout there in the education sector going at this stage?
Well, fortunately, it's much like Linda was saying, that the rollout has been smooth so far. There was the official launch that took place at the KwaMashu Indoor Sports Center this morning. That's where the Education MEC as well as the Health MEC was. They were overseeing the process, and one of the things that they were saying there was that they were hoping to, at that one center, vaccinate at least 500 people during just today. Now, you know, there's about 127,000 teachers as well as support staff that are eligible for the vaccine, but of course no one is forced to take it. The Education MEC is saying to us, though, that if a teacher opts not to take it, then they don't have the option of, for example, saying that in some cases support staff can't say that they then would want to work from home, for example. But although the rollout has been smooth so far, we are waiting to hear back from SADTU, who had initially said to us that they had some concerns with how the process was managed. Now, those concerns related to the planning of the rollout, and they felt that they were not being included in that. Education Department said that they had to present a plan to all of their stakeholders, including the unions. So SADTU is getting reports back from all of the regions, and I expect that they will share with us what has transpired in areas that are further out, especially where there were concerns about how teachers would get to these vaccination sites that were much further away, particularly in northern KZN.
Thank you very much, Dasen Thathiah, for that quick update, comprehensive overview of what's happening in Durban. And thank you, Lindokuhle Xulu in Kanana in Northwest. Of course, we'll continue monitoring the situation throughout the day here on eNCA on this day one of the vaccination of the education sector in our country. But now